Alright, so I'm going to be doing a posture assessment here, and I like to start from the feet, so go from the ground up. That, to me, just makes it a little bit easier to see where your baseline problems are and then work your way up from there. So the first thing we want to look at the feet, we want to see if they're either pronated or supinated. So either kind of rounded in or more rounded out. That's also going to show us if we have pes cavus or pes varus at the feet. So that's going to be the first thing we look at. One thing that we can also look at is the Achilles back here. We want the Achilles to obviously be in a straight line. On him, they look pretty good, but oftentimes if we have a malalignment, you'll see them kind of turned one way or the other. So the next thing we want to look at is the position of the feet. So from the posterior view, if you can see the feet, or the toes, turned out to the side more, that's going to give you more of a duck-footed position, or opposed to the feet turned in with the toes. If you were able to see them more through the middle, you're going to have more of the pigeon-toed position there. After we leave the feet, we want to look at the calves. We just essentially want to see if the musculature in the calves are even from side to side. So here they do look to be even, which is good. After that, the next thing we're going to look at is the knee crease. Essentially on the knee crease, we want to see if it's even on each side. So here it looks to be on this side that this one's a little bit higher, maybe slightly elevated, not much, but just a little bit. And so what that can tell us, we can begin to see if there's potentially a leg length discrepancy or tightness in muscles somewhere. So, and we'll get to that more once we get to the pelvis, but that'll kind of be our first cue that something may be up on this side of the body. After the knee crease, the next thing we want to look at is the glute crease. Again, kind of similar. We just want to see if it is level on each side. We also want to look at the musculature, see if that is level and even on each side as well. After the glutes, the next things we want to go to are the PSIS. So here we want to look at the height of the PSIS. We want to see if it's level on either side. So his are not super prominent, but see about right there. And his, let's see, this will be his right side. Seems to be a bit elevated than the left. Looking at the PSIS can begin to tell you a lot of different things. We can obviously see if one side is higher than the other. That'll show us if there's a lateral hip tilt to one side or the other. We can also look at its position as far as telling us if there's an excess lordotic curve, or if there is not enough, and giving us more of a flat back presentation. So after we look at the PSIs, we're going to go ahead and work on up to the upper back here. The first thing we want to kind of look at is the scapula. So the position of the scapulas. You want to see first if they are level, which they seem to be in this case. You also want to take note of the distance from the inferior border of the scapula to the spine on each side. That'll give you a good indication of if you have some rounding going on in your shoulders or not. You also want to pay attention to abduction and adduction, as well as winging of the scapula, which do not seem to be very prevalent here. The next thing we want to examine, move your hair out of the way a little bit, is we want to look at the musculature of the upper back. So this is across the shoulder blades, the rhomboids, the traps, and the shoulder musculature. We want to see if it is equal on the left and right side, see if there are any discrepancies. And it looks to be that on this side, well, it looks pretty even for the most part. There may be a little more bulk on this side than the other, but pretty even for the most part. But you will notice as well that we'll get into this more in the anterior view, but the right shoulder seems to be a bit more slouched on the right side opposed to the left. And again, I mentioned earlier that the right hip is a bit higher, so puts him at a bit of an awkward angle on that right side. After we look at the shoulder region, we're going to begin to look at the neck. We want to see if there is any cervical rotation. So essentially, in order to assess that from directly behind, you want to see if you can see one side of the client's face better than the other. And this could be caused by, if they sit at their desk and their computer is off to the side, one way or the other, that can cause a rotation in the neck. And in him, I'm not seeing any of that, which is great. You also want to see if there is a tilt to one side or the other, which does not seem to be apparent here. And then the last thing from the posterior view is ear level. From what I can tell, they seem to be fairly even. The right side may be slightly lower, which would correlate with what we talked about, the shoulder here, the right shoulder slashing a bit more. But for the most part, they seem to be fairly even. So once we finish up the posterior side, I'm going to have him turn to the side where we have a lateral view, so it doesn't matter either way. So yeah, just stand how you normally would. Perfect. So from the lateral view, the big thing we're going to see here is the position of the spine. We want to draw kind of an invisible plumb line from the ear all the way down to the ankle and see what that line looks at. So we're actually going to start from the top for the lateral view. The first thing we want to see is the position of the head. A really common thing in our society today is a forward head posture based on, or because of looking at cell phone screens or computer screens or tablets and looking down a lot. So that's very common. We do see that a little bit in him. You can see this excess curve right here in the back of his neck. His head is just slightly forward, giving him just a slight forward head posture. Again, we want to take into consideration the position of the neck. In that, we also want to look at the shoulders. We want to see if they are pulled back or rounded forward. Here, we have a little bit of a curve going forward to the front. The next thing, as we work our way down, again, we want to look at the thoracic spine. So we want to see if there's any excess kyphosis or if we have more of a military back position. In his case, there's a little bit of a kyphotic curve, not to a super high degree, but we do have a little bit there. So going back to the invisible line that we talked about, this line, if we had a line that dropped all the way down from the ceiling, it would go through I can't remember the name of it, but the middle of the ear here. Then we would draw a line through the shoulder here, down through the middle of the abdomen, the hip, the knee, and then down to the lateral malleolus of the ankle. And ideally, we would want that line to be essentially straight all the way down, with the exception of the bottom of the foot. It would be a little off just because of the natural curvature of the leg. But here, with the forward head posture and the kyphosis, that line, we can see that the ear is slightly in front of the shoulder, so that line would not be perfectly straight, would be a little bit off. Again, as we work our way down, we want to look at the lumbar spine as well, see if there's any excess lordosis. Here, we do see a little bit, and the lordosis here, and in combination with the kyphosis up top, are probably one of the two is a compensation from the other. So we see a slight lordotic curve here. Once we look at that, we want to take into consideration if there could be either an anterior or posterior tilt of the pelvis. It looks to be that there is a slight anterior tilt here of the pelvis. Nothing too major, but just a slight tilt there. We also want to, again, consider just the musculature that we can see, that we can see, and make sure that it is all even. A really nice view here of the knee. We want to see if there is any genu recurvatum at the knee, which is essentially hyperextension. He does not seem to have that. And then again, back to our invisible line, if it's dropped from the ear, we've gone through the pelvis, down through the knee, then it would drop down to the ankle there. So for the most part, our invisible line looks like it would be in a pretty good spot, with the exception of here at the neck and thoracic spine with that little bit of kyphosis and the forward head posture. So the last view we will go to is anterior. So you can turn and face the camera. Perfect. So again, like what we did for the posterior view, we're going to start at the feet again. Here you'll get a really good view of whether or not we have that pigeon-toed or the duck foot going on. He does not seem to have that. His feet are fairly straightforward. You know, you want to see a slight degree of rotation out in the feet, but his are in a good place, so that's good. We also want to look at, again, the pronation and supination of the foot, whether or not we have pes planus versus pes cavus. Then, again, we can look at the calf musculature. We have a better view of that from the back, but you can still see it a bit from the front. We want to see if that musculature is the same and equal on either side. Again, we want to look at the knees. We want to see if we have a knee cave, a knock-kneed presentation, or more of a bow-legged presentation. And so that would be either genu varum or genu valgum. He does not seem to have either, but it is important to pay attention to not only the look of the whole leg, but the position of the patella. That can tell us a lot as well. So if we look at his patellas, they both seem to be slightly pointed out, and the position of the patella can tell you a lot of things. That can either give an indication that we might have a slight hip, in his case potentially external rotation, or if they're pointed in, internal rotation. It could also indicate that you have some kind of issue going on at the tibia, so some kind of tibial torsion going on. There's a big, large variety of things that could be going on there, but again, we see that each kneecap is slightly pointed out, which again is interesting to note considering his feet are in his normal position fairly straight ahead. After we look at the rotation at the knee, we want to take note of the Q angle. The Q angle is not something that can really be changed necessarily. We're not going to really be able to change the bony presentation in an individual, but in general, in males, the Q angle is a smaller angle than it is in females. So just something to take note of in your client. Again, we want to look at the quad musculature. We want to see if it is even on either side, which it seems to be here. We want to again look at the pelvis. So this view gives us a really good idea of if there is a lateral tilt to one side or the other. So in the back, we discussed, I believe it was his right side being slightly more elevated than the left, which you can see here. It's not to a great degree, but it does seem that the right side here, his hip is slightly higher than that on the left. Again, this could be due to a number of things. It could be a tight QL, it could be tight hamstrings on the opposite side, it could be a leg length discrepancy, it could be a slight scoliosis in the back. There could be a lot of factors causing the lateral hip tilt. Let's see. Another thing we want to take consideration of is the position of the hands and the elbows. So in anatomical position, his hands are in a good place. One thing you don't want to see necessarily, you don't want to see the palms facing completely posteriorly. That's going to cause your elbows to flare out laterally, which can also create a rounded presentation in the front. His are in a good position. You want to take into consideration the position of the arms and whether there is an increased abduction or adduction to them, and if it's the same on either side. So here we look to be essentially the same on either side. The arm may be a bit closer on this side, which would make sense since this hip is a bit more elevated than the other. After that, we want to look at the carrying angle. So we mentioned this a bit in the posterior view. This is again how the shoulders look. So if you take a look here, let's see, you can see that this shoulder is slightly slouched more than the other. Again, not a huge degree, but just a bit. That's what we want to take note of. Ideally, you would want to see both shoulders level. You don't have a slouch on one side opposed to the other. But again, this can be caused by a number of things. This being his right arm, he has right arm dominant. So that may be, if he's carrying a heavy book bag or a heavy load of groceries or whatever, that's probably the side that's going to get the largest load, dropping that side down. Again, with the musculature of the chest, we want it to be even on one side to the other, and it seems to be here. We want to look at our shoulders, see if they're rounded forward or not. Again, with the muscle tone, we want to make sure in the shoulders and in the traps that it's even from one side to the other. And as we mentioned in the back, this side does seem to be, this side seems to be slightly more, a larger degree, seems to be larger, that's where I'm trying to get with that, than the other side. Slightly more toned on this side than the other. And then we want to go up to the neck and the head to finish off. So we want to see if there is any tilt, again, to the head or neck. Here, maybe a slight tilt to his right, our left. Again, nothing major there. We want to see if there's any rotation. So if we can see one cheek more than the other, he does not seem to present with that. And then the last thing is going to be the level of the ears and the eyes, whether they're in line with one another. And on him, again, because of that lateral head tilt, the right side seems to be a bit more elevated than the other. But in that, you have to be really careful because